Hey everyone, welcome back to Nova Pain and Rehab Center. So today we're going to start a new series. This is going to be a core stability series. We're going to start with some core stability movements for the lower back and hips, and then eventually work our way up to the mid back, upper back, and neck. Today we're going to start by showing one of the best core movements for the back and hips. It's called the Pallof press. Now in rehab, this is a pretty common movement. A lot of therapists will use this with their patients with pre-existing or back injuries. In the real world, in the exercise world, not as much. This movement is a staple to all core back exercises. It works on the rotational muscles through the spine to limit the rotation of the lumbar spine, which is what causes a lot of the back and disc injuries that we see. We'll go through some different variants of this, and all these movements are utilizing the Pallof press movement, just kind of working some different associated muscles at the same time. So, try these different movements if you have the equipment, or you can do that. See if they work for you. You'll be surprised on how difficult these movements actually are. Okay, so let's get into some anatomy first. All right. Okay, so we're going to show you some anatomy of the back. So this is one of the main muscles that this will affect. It's called the quadratus lumborum, or the QL. It's a back extensor. It attaches to the transverse process of the spine, and then, as you can see, to the top of the hips. So very, very important muscle in spinal stability. We also have your external obliques. They attach to a number of segments through your ribs and also through the top of your pelvis. And then we have some of the other deeper muscles in your back. This is called your thoracic longus muscle, as well as your retrospinae muscles. And so all these muscles group together to create stability for the lower back. Okay, so let's go ahead and get into this. So we're going to show you what the Pallof press is first. The Pallof press is a very simple movement. What we're going to do is we're going to use a resistance band, and this is in one direction. So you want to train this movement in both directions. You're going to simply slowly push the band out, contract the core by pushing your belly button to your spine, lock the core down. You're going to hold that for about 4 or 5 seconds, and then bring that back in. Rest, loosen the core, and then bring that back out again. And hold. So this is the basic movement. So, what is the Pallof? It's an anti-rotation hold exercise that helps in developing a stable core, especially in in movements where or exercises where there's some rotation involved. Okay, so all right, and so the next what we're going to do is we're going to use the rotational component with this, and this is using the opposite muscles as the resistance. So she's going to come and rotate around to the opposite side. Again, we're adding some different muscle groups into this movement now. So bring it in, we're going to bring it out, hold, stabilize, and rotate around. See if we can hold that in position for about 2 or 3 seconds, and then come back in. Okay, and we're going to do this. We're not going to demonstrate this, but we always want to do this on both sides. Usually 8 to 10 times each side, if you can get to that. A lot of it depends on the resistance band and how much resistance the band's applying. More resistance is going to be a little more difficult to do. Let's come around one more time. Good, and back. Okay, great. So the next step we're going to do is adding some muscles of the legs. Now this is a more advanced movement. If you have lower back pain, you have acute, subacute back problems, probably is not the movement yet, but from a core stability, from a maintenance or progressive core stability exercise series, this is a great movement to do utilizing this exercise. So we're going to do the Pallof press. We're going to press out. Okay, we're going to go into a squat, slowly come down. We're going to hold the bottom of that for about 3 seconds, and then come out. And that is really going to engage those muscles in the back. And come down again. And for this, again, 8 to 10 times if you can get down to it. You want to try to do it on both sides. If you have a little bit more resistance, you may want to cut that down to 6 to 8 times. And down again. Okay, good. Okay, so we're going to do one more part of this, and this part's using a reverse lunge with the Pallof press. Again, an advanced movement, but excellent movement to do if you're trying to find some movements to engage your core muscles. And then back up again. And then she's going to do the other leg. Good. It is surprising how difficult these movements are. It really is surprising. It may take you a couple times to even get in a position where you can go through the full range of motion. And then she's going to come back up. Again, 8 to 10 times if you can. And then make sure that you reverse it, so you're going to be doing this on both sides. Okay. All right, thank you. That's called the Pallof press. Okay, thank you. Okay, so we decided to start with this one just because it's a unique movement that a lot of people don't even know about. And in creating a core stability program, you need to find out the movements that work best for you. It doesn't take a whole lot. We usually recommend about 3 times a week, maybe 15, 20 minutes. That's all it takes. So if you suffer from chronic back problems, hip problems, anything to do with the back, you should be doing some type of core routine. Try these movements, try the first of those series and make sure that works for you, and then you can kind of progress through the different movements to whatever level that you're at. As we've mentioned before, if there's anything that these movements are you're having trouble with, or you have any questions on, you can always contact our clinics. Our Arlington office, we can be reached at 703-535-8887, and our Percival office is 703-376-3797. If you have any questions with this specific movement, you can go to our websites. There's an Ask the Doctor tab, and those questions come directly to me. And of course, I'll always get back to you with those. So hope everyone is staying healthy, and we look forward to our next core video. Thanks and have a good day.